All right. Hello, Mia. Thanks so much
Hello.
for thanks so much for doing this talk with me. You contacted me a while back about coming to Little Rock, Arkansas to teach my Foundations in Manual Therapy, Voice and Swallowing Disorders class and help me locate a facility, which was great work on your part. So I'm very appreciative. But can I just ask, what was your interest in the work that I teach? Because it's not exactly mainstream for massage therapists being a voice and swallowing, at least that's the title of the class.
Yes, and I want to thank you so much for agreeing to come to Little Rock. First of all, I'm very excited to take your class. Um, I am personally interested in taking your vocal and swallowing disorders class for lots of reasons, but mainly because I work primarily with neurodegenerative patients, especially those with ALS. Also, because I have personal selfish reasons for taking your class. I have oral pharyngeal dysphagia and spasmodic dysphonia. So I'm very intrigued to learn what I can from you for my own personal reasons. I also think that the Little Rock community would very much benefit from your paradigm shift here, learning about less of an operator mentality and more of an interactive mentality work to myofascial release.
Yeah. So you and I are co-members of a couple of groups on Facebook, all of them sort of outlier groups, I might call it, but away from the norm of, the big box modality empire type things that I know I certainly trained in and learned a lot of this work from. But I don't know exactly your background, but our views are quite different than mainstream, both physical therapists and massage therapists, I guess. But there's more and more of the look toward, the multifactorial impact of any kind of touch-based intervention. And that's my MO with this class. It's not just about speech pathologists, which are one of the primary people that attend the class, but I get a lot of massage therapists, PTs, OTs who are working with that performer maybe, or the voice disordered, the swallowing disorders. But what some of the cool part to me is the new stuff we've been doing with tongue-based work for swallowing work for the myofunctional community and just for overall, call it wellness in a weird way. So
Mhm.
I don't want to sound like I'm trying to make a class that's suitable for the entire population, right? But I really
Right.
see my work as being very applicable to at least a lot of what massage therapists are, and who massage therapists are working with.
Yes, and I agree with that completely. And I also think a lot of speech language pathologists maybe don't realize that they can do hands-on work.
Yeah,
I know the ones that I've seen, it never occurred to them to do hands-on work.
yeah,
So I think that's incredibly beneficial too, because
yeah,
I could have benefited from that personally.
yeah. And their scope of practice is really different from mine as a physical therapist. It's unbelievably broad and vague in a really good way. Meaning,
Yeah.
if it applies to the populations and it's in their evidence, then with training, then it's an appropriate intervention for them. Unlike you and I, where it's obvious that touch-based interventions, at least for some PTs, are kind of the mainstream of what we're doing. So
Exactly, yes.
yeah,
And like you, I did start out, I started my career learning core body work, which is basically structural integration.
yeah,
And so like you, I trained a lot in these Facebook communities and self-knowledged my way into more of an evidence-based paradigm.
yeah. It's such a interesting process that the continual churning out of new therapists, massage therapists, PTs, all sorts of therapists. You would think that over time, somebody would start waking up in the educational field to say, you know what, these rabbit hole approaches of myofascial release and all these like singular models of what's wrong with a person and how we're impacting them, that we should be starting to see the light through this, that they're too simple to be accurate because we're working with a
Yes.
human being and not a person's fascia or not a person's, inhibited glut. We're working with a human being. And
Yes.
yeah,
That's the key. We're working with a human being right there.
exactly, exactly. But yet we're still coming out, or people are still coming out of school thinking, oh no, this is about the muscle that's in distress. And I know those are nice little metaphoric type of representations, but those simplistic models simply have to go, but they're not going away, Mia. And we talk about this all the time on some of these common Facebook groups that we share, and almost like the head banging frustration. But I don't know, maybe it won't ever change, and all we can do is sort of, carve away our little corner of this evidence-informed type of world.
I think it's very frustrating for a lot of practitioners. I mean, human brains are pattern seeking, and we want to have very simplistic
Mm,
answers. We want to have mechanical answers in order to help people. And the reality is much more complicated, much more nuanced, and much
yeah.
more murky.
Yeah. And I kind of have embraced that murkiness to realize that, you know what, the more I learn, the less of which I really think I know anymore, because the more every new model that I'm exposed to makes me realize there's so many possibilities for why touch is impactful beyond what we think we're doing to the tissues,
Mhm.
right? And I actually love that. And a lot of people are frustrated by it. A lot of people are really, they get defensive because it sounds like, especially in my past tribe of myofascial release people, that I'm kind of knocking the fascial model. And in a way I am, but in a way I'm really just saying, can we really be so certain? And I don't know that we can. That
You
doesn't
know,
that doesn't make us less effective. In fact, personally, I think it can make me more effective by understanding that I can't treat a person's muscle or fascia. I treat the person. So let's leverage that piece of it.
yeah, I think it actually opens us up a lot in so many different ways, because if you're treating the brain and the whole person, I don't know, the possibilities are endless. Whereas if you're just treating the glutes or the fascia, you're limited.
Yeah, exactly, exactly. But again, I think we both recognize that we are in a minority there, and you know
Yes.
what? I'm okay being in that minority position because it makes me feel less, I don't know, morally obligated or something like that. I don't know. I just feel like I
Mhm.
can actually be true to myself and say, you know what? We know a lot of things, but we're not certain about a lot of them, even though we act like we are.
Yes, I agree with that
Yeah,
completely.
yeah.
Um, it's
Well,
taken me
good.
a long time to come to that position of, to be able to be centered in that position, because it is hard. It is a minority position.
Yeah.
So
We in our communities, but our patients as well. Do you struggle at all with that? I know
for
I do at
sure,
times because they
yes.
expect me to tell them about, I'm here in my office right now. They expect me to tell them about that tissue in distress. I can talk the language because I don't want to completely separate themselves or make them feel like they're wrong. But it's like, okay, let's introduce some other options. How about you? Did you struggle with that?
I still struggle with that. And I'm not entirely sure that debunking their thoughts is the way to go here. I'm not sure that that's helpful, even if I think that they're incorrect about their beliefs.
Yeah,
That may not be helpful to them in the long run.
yeah.
So I do struggle with that a lot.
And I like to keep in mind that even if I think another person's opinion is wrong, I've not lived their life. I've not walked in their shoes. And
Exactly.
when I kind of, cross the chasm, as they like to say, from MFR into more neurocentric base, I was a real jerk for a long time because I really did
Yeah.
squash people's stories. And then I realized somewhere in the middle is the sense of allowing somebody their own story, but also introducing the sense of another story. And if they're
Yes.
comfortable with uncertainty, a couple of stories, but can we move forward without it being what's wrong with your tissue? Can we help you move on from this problem instead? And that's worked
Yes.
fairly well for me.
The power of yet and the power of and is really helpful in my massage practice,
Yeah,
because it doesn't have to be one or the other. It can be both.
yeah, absolutely. That's really well put. Thank you. Yeah, yeah. Well, I'm definitely looking forward to coming to Little Rock, and I do appreciate you taking the time to just, to chat with me a little bit. And it's certainly applicable to a lot of the classes that I teach. And I love the diversity of audiences that I get because we certainly get speech pathologists, but we get a lot of MTs, PTs, OTs, and then we move off into these other areas where, believe it or not, dental hygienists come sometimes because they're working with myofunctional disorders of
That makes
mouth
sense.
oral motor exercise and everything. And
Mhm.
I really love that diversity, not just of population, but the diversity and the conflicts within thought and belief too. And how, we get a chance to really sit down and in a mature way, kind of discuss those. So, yeah, looking forward to it.
I really think you're gonna like our small town here. It's a great place.
Great, looking
And
forward to it.
I hope that we get a great audience for you.
Great. Thanks so much for facilitating and taking the time today.
Well, thank you for having me. It's been a joy.
Good.